record, and we're on. Hi, everybody. Today we're here with Anisha Abraham and Cara Natterson. They are both pediatricians. They are both authors. Anisha is an author of the new book, Raising Global Teens. Cara is the author of Decoding Boys and the founder of UMLA, a puberty lifestyle company. Are there any different ailments during the pandemic than what you saw before, or an increase of prior issues?
Well, I certainly think that there's been an increase in behavioral health and mental health complaints. And what we do know is that more kids are feeling isolated, they're feeling uncertain about the future, they're feeling anxious, they're feeling stressed. And so we're seeing more young kids that are actually presenting with signs and symptoms of depression and anxiety. And I think that's really important for caregivers to be aware of how to get them the support they need. We also are seeing that less young people are going in to see their doctors. As a result, there's a lot of missed opportunities. So we know that for young people that are not getting vaccinations, for example, because parents are afraid to bring them in, certainly they're not also getting routine screening for STIs. They're not coming in sometimes for even their mental health that they should have been seen for, and maybe for contraception and routine contraception. So there's a lot of missed opportunities that are also occurring. And I think it's important to make sure that parents, caregivers know that they can do a lot of this now through telemedicine, but they need to get back to all those routine appointments and things that they have been delaying on.
Also, like as a parent, I have found that the places that, like a doctor's office, they're the most careful in terms of protocol and how many people can be sitting in the waiting room. Often they're having us wait in the car and call us when to come in. So it's not like going into the grocery store where, there's a lot of people on top of each other. Are you saying that also?
That's so important to emphasize. So, physicians not only have mad respect for this virus, but they've done a lot of things from day one in order to keep their patients safe. And so patients and families should not be afraid about accessing care from their doctors. We know that, I just read yesterday, 20% of all healthcare visits happened virtually over the past couple of months. We're seeing that people loved telemedicine and they're accessing it. So telemedicine is a great way. But then if you have to go in, absolutely right, Susan. Doctors' offices are aggressively socially distancing. The doctors are masked and often shielded, as are all of their staff members. Their hygiene is impeccable. They're washing their hands before seeing every patient and after seeing every patient, which, by the way, is nothing new for them. This is something we're trained to do early on. So I cannot echo Anisha enough. Go in and see your doctor when you need to go in and see your doctor.
Can we go back, Anisha, to depression and anxiety and just talk a little bit about, all of us have, and all of our kids have some of that in their being. When is the point where we should worry? Are there signs that we should be looking for as parents that indicate that this is more serious than just your everyday stuff?
I would certainly say if you have a child that is not engaging in social connections in the same way that they were before, they're not reaching out to their friends or their peer group, they're not engaging with their family members, they're having changes in their sleeping or eating patterns, if they at all are referring to feeling really down, sad, or that life is not worth living, they're talking about suicide or writing about it, those are big red flags that there might be something going on. And certainly there are certain kids that are more at risk than others. If they've had a previous history of depression or anxiety, if there's been a family history, for example, of suicide or depression, those kids are at higher risk. Kids that have been bullied or cyberbullied, those are young people that are slightly at higher risk for all of these issues. So just being aware of that and having conversations, I think, is so important. This is a time for parents and caregivers to keep connecting with their kids and seeing how they're feeling and looking out for those signs. Most of us know our kids quite well and can understand a little bit of those changes that might be occurring, and getting them into support early on is so important.
Can I just jump in and say it's tricky because a lot of the signs and symptoms that Anisha pointed to in pandemic are also part of the normal spectrum. So it's not just, are those features there, but are they remarkably different from prior? And is there a whole cluster of them? Let me give you a for instance. Kids are not connecting with their friends as they did before. That's the bottom line. And yet that is a sign that a child may be heading towards depression or depressed. So how do parents tease those things apart, right? How can a parent tell if their child is feeling disconnected and not engaging with friends? Is that depression or is it not? And it's kind of a big constellation of symptoms. You have to look at who your child is. You have to be able to understand, is it that they are not connecting because they are tired of screens? They have Zoom fatigue after a long day at school. They just don't want to be on a screen with their friends. And is that okay for them? Or are they not able to connect with friends or not willing to connect with friends? Are they spending their downtime, their weekend times alone and withdrawn from their friends? So a lot of the indicators that used to be much more clear in terms of depression and anxiety have gotten very murky in a time of pandemic when kids are being separated from one another.
So you two have inside information. From the parenting side of it, it's always been a nightmare because so much of the things that you talk about are normal adolescent behavior as well. So you're saying it's way worse because of the pandemic, but also it's way worse because of adolescence, because it's a little bit hard to tease out what's that normal growing pains of life that give us those symptoms and when is it exaggerated. So first of all, it probably never hurts to get someone else's opinion, right? Like if you're at all wondering.
100%. I mean, especially someone who you trust, a family physician or a pediatrician, a school counselor, a teacher who your child is really connected with. You know, if it's someone who knows your kid and you're trying to get a gauge, reach out to one of those trusted people who can hold a mirror up to the situation with you.
Okay, so we sent our kids to school and there were many protective factors in that school environment. A lot of other people, a lot of other touch points from adults looking at our kids. Are there ways to still kind of get that if you're all virtual right now?
Oh my gosh, Susan, that is such a big and important question. I think there are many tremendous issues with virtual schooling. Okay, everything from equity and access to love, you know, sort of this squashed love of learning if kids are getting fatigue on screens. But one of the biggest is the loss of touch points between adults who are in the education system and kids that are showing up in classrooms, because it was undervalued prior to pandemic. We all knew at some level, but I think as a society, we really undervalued the role that teachers and administrators played in just laying eyes on kids and being able to gauge, is this child, you know, disheveled, tired, withdrawn, sad, not communicating? Are there any signs and symptoms that I see as an educator that would raise a flag that maybe no one else is going to see? And we have lost that touch point, and teachers around the country are educating themselves as to how they can use virtual learning to assess some of those parameters. They are trying to figure out, how can I look at a kid on a screen, much the same way we're looking at one another, and try to gauge some of those variables in the same way I did in the classroom. And it's a very steep climb, but every educator I've spoken with says that they take that piece of their job extraordinarily seriously.
Don't you have a sense of like such grander love for teachers?
Oh, I mean, I always had love for teachers, but my God, yes, right?
So Anisha, how do we deal with this as parents when some of us we're not even good at it? We're just not all able to see the nuances in our kids' lives and, more importantly, know how to respond to it. So I want to take us back to what you brought up, which was anxiety. I mean, we throw around anxiety a lot, and we throw it around in terms of the uncertainty of the pandemic. So is that like a diagnosis if your kid is highly anxious around something that's real and that we're all experiencing? Is there any distinction between those two things?
We do have kids that are baseline anxious, but we also know that there are some kids that may not have been anxious before, and simply the fact that they're worried that they may get an adult member, someone that's immunocompromised, sick. They're anxious about not seeing their friends or going in or doing the usual things. There's another level of anxiety that also comes out of the pandemic. So kids that we ordinarily may have again, not had issues, we're now seeing are emerging with that level of anxiety. So I think it's important to be aware that we're having a new set of issues evolve as a result of the pandemic.
you know, it's important, I think, to define the terms, right? Because there's a difference between stress and anxiety. And when people understand that difference, we use the language a little bit more effectively. So stress means a response to an immediate threat that's right there. And anxiety means that same type of response, but the threat isn't right there. So it's the worry or the cortisol response in your body when the threat may have been removed by a day or by 100 miles or whatever it is, right? What you're asking, Susan, is a really good question. Is the pandemic a present threat? Does it cause stress? Or is it a theoretical threat? Does it cause anxiety? Doesn't really matter in terms of pandemic, which term we use, but I think as a group of parents and healthcare experts who hope to educate other parents, one of the most important things we can do is help them use the word carefully so they don't pathologize a situation. So in my book, this is stress. We have a pandemic. It is on our earth. It is here. And we are all trying to manage it day to day, week to week, month to month. That to me is stress. When the pandemic causes a death in the family, the resolution of all the feelings around that death, that's anxiety. Does that make sense? So, and the way we address ourselves and our kids around these issues are different. If it's a stressor or if it's an anxiety, if it's present or if it's theoretical and absent.
Is it fair to say that whatever we're dealing with, that parents who don't know what to do should reach out to a pediatrician as a first line of defense?
100%. I just make the distinction because I think anxiety is a term that has been softened over time. I think people don't recognize the power of anxiety because the threat isn't really there. And I think parents need permission to get help. And by the way, I think healthcare providers need permission to be able to say, nobody really knows. This is all new. This pandemic is 8-9 months old, depending upon where you are in the world. So everyone's learning. And that in and of itself is a stressor, right? It's a stressor that there is no one who has more than a year's worth of knowledge of this entire pandemic. So let's help one another. Parents, reach out and get help. Healthcare providers, tell the parents when you can provide it. Tell the parents when you've hit your limit and see if someone else can back you up and help you out there.
I was just going to add to what we've just been discussing and to say that it doesn't have to be a pediatrician. As Cara's mentioned, it can be, again, the teacher, and teachers are now much more aware of what's going on and trying to support. It could be a counselor through school. It could be a coach. There are many levels of folks that you can reach out to if we're talking about stress and supporting young people in stress. But certainly pediatricians are very attuned to this. They're there to support and to find out what's going on and to make sure that kids get that care. But let it not be a deterrent. There are many levels of adults that are capable of providing that support. It's really going to that next step and being able to provide it.
Dr. Anisha Abraham, Dr. Cara Natterson, thank you so much for being here with us.